All right, everyone. Today I'm here with Dr. Jory, and Dr. Jory is a chiropractor and sports therapist. He also has a YouTube channel where he specializes in fitness, health, lifestyle, and nutrition information and education. So I'm going to leave a link to that in the video description below so you can go check out more of what he's got. But in this video, we're going to focus a lot on the shoulder, because from my last video where we talked about strengthening the shoulder and stabilizing the shoulder to help with boxing, also had a chance to discover that a lot of people out there have shoulder injuries in different parts of the shoulder, different causes. So in this video, we're going to focus more on injury prevention, also a little bit of rehab. So Dr. Jory, in your opinion or from your experience, what are some of the most common injuries that you see from boxers or even anywhere athletes are heavily using the shoulder? You could tell me a bit about that.
Right. Jason, what I can tell you is I've been treating people for almost 20 years, and probably the third most common thing I treat is rotator cuff injuries. That goes for boxers, it goes for athletes of any discipline. It also goes pitchers.
Yeah.
When they're throwing, slowing their arm down so it doesn't fly off their body.
Right.
But even just people sitting at a desk all day, internally rotated, mousing and typing in crappy posture.
So not just the boxer, but the average everyday
It
person.
affects everyone. It's so common.
So in terms of everyone being affected, and let's say boxers, I mean, I know a lot of people out there have different injuries in the front, underneath. What is the most common injury you see? I mean, I know me personally, it was right along the front deltoid there. What's happening? What's going on with most people there?
Well, you nailed it dead on right there, Jason. This right around the front of the shoulder, that's the most common place where you will feel the symptoms.
Right.
It's going to be a kind of pain there. The things I ask for is, how is it like putting your jacket on or putting a shirt on? That usually hurts. If you go to lift something up like this, like maybe a suitcase or a bag, that'll usually annoy it. But what's going on there is you have the rotator cuff muscles, there's 4 of them, and they all kind of attach right around the front of the shoulder.
Oh, I see.
In addition to that, there's a little bursa there, which is a fluid-filled sac, and that can get inflamed. So most of these injuries, it's a result of inflammation, which causes friction, and then you get stuck in this friction pain cycle of inflammation pain that it's hard to get out of once you're into it.
Okay, so before we get into, let's say somebody has an injury, and before we get into the part of helping them heal or helping them with that inflammation, let's say somebody is new to boxing, they're not really injured yet, but through the whipping motions or these type of boxing explosive movements, are there any exercises or anything you can recommend to prevent that from occurring? How can a new boxer ensure that they don't get a shoulder injury?
So I watched your video, and it has great exercises for shoulder stabilization.
Okay, cool.
I really like that.
Cool.
In addition to those stabilization exercises, something that is very important to teach people is that your shoulder blade is not flat on your back. It's actually on a 30-degree angle.
Ah, I see.
So you get a lot of people who think that they want to strengthen their shoulder up for boxing, so they're going to do the lateral raises.
Side lateral.
Because they want those delts popping.
That's right, that's right.
However, that is an unnatural movement to do this. And in fact, you can try this at home. Jason, you do it as well. Take your arm and just go straight up like this. And now take it in a 30-degree angle with the thumb up and tell me what feels better on your shoulder.
Yeah, I can feel it tight going back this way. It's tight across the front. And
it's kind of an unnatural feeling there.
Yeah, I'm definitely working for that. And then here, this is as easy as 1, 2, 3.
So speaking of easy as 1, 2, 3, instead of using a big dumbbell and trying to get those big delts, instead you could grab, I've got a 10-pounder here.
Right.
Even this might be too much for some people. 5 pound is good, 2.5 pound. All you need to do is bring it up in 30 degrees with your thumb up. And notice how I'm keeping my shoulders down and back. I'm not in this position. I'm not clenching. I'm right here and I'm coming up like this.
So this would be an excellent strength training exercise directly for boxers.
Yes.
That if I'm new to boxing and I want to make sure that my shoulders are staying strengthened using resistance training, this is one exercise I can do. So let me go through a little demo. Let me demo myself so I can get the feel. So here, it's thumbs up, and I want to make sure that my shoulders are back.
Yeah. So we call that scaption, bringing the shoulder blades into the scapular plane, relaxing your shoulders, so you don't want your traps to be too active on that.
And then from there, 30 degrees up.
You got it. Yeah, and even bring the hands forward a little bit more. And try now with the thumb. Arm is more straight, so it's right there. That's it. Now you got it. Now you got it right there.
Arm is really straight.
Yeah, keep the arm straight. You got it there.
Oh, yeah, yes, right. Because what I find in boxing is that is my weak point. Like when I throw a hook, I feel it right at that pull point. So this is
right.
When I have it straight, it's going to strengthen me.
You got it.
Through that as I go. Once I get here, I'm good. But it's this initial yanking pull as I come through.
And just to go back to what you were saying about boxing injuries, when you are repeatedly bringing your arm in an internal rotation like this, look where my shoulder is now.
It's now in that
really
concave.
pushing it forward. And that's putting pressure on that bursa, and so that's a major cause of injury right there from boxers.
Is that the inherent in boxing itself is
you can't really help it, right?
Yes,
That's just the way boxing goes.
Okay. So one thing we were talking about earlier, there's another preventative measure, is not just for boxers in this position, but people at a computer, anybody doing that, because even I have that a little bit, the shoulders forward. You're saying a daily exercise would be this reach back or stretch back?
Yes.
Can you talk about that or demonstrate
Sure.
that?
Most of the people that are into boxing, that's not the only thing they do. They might have day jobs where they're sitting all day at a computer. Even if they don't have a job where they're doing that, they're probably, checking their Facebook, Instagram, whatever,
like this.
or doing this. So what you want to do is set a reminder on your phone. Really simple thing to do. You can just take your timer, set it for 15 minutes.
Right.
Every 15 minutes it goes off. As soon as it dings, you stand up, you do a counter pose, a counter stretch. This is the opposite situation that you're normally in. Everybody's always hunched forward. If you do this one now, you're opening up your shoulder and your chest, you're stretching your pecs, you're getting your shoulder in a better position here instead of it always being internally rotated.
Okay, so let's say I'm working at my desk, or even let's say in between boxing rounds, this is for the boxer, or I'm working at my desk, and all I'm going to do is, so if you could break down the details for everyone out there who's watching, I want to bring my shoulders down again, do the scaption.
Yeah.
I don't want to be like this.
That's right.
Bring the shoulders
Relax down.
And then I'm going to
open your chest up.
And then just fall back.
Yeah. So you're doing a back extension. You're doing a chest stretch. You're getting a stretch in your biceps as well.
Which is another big deal.
You're also getting it in your forearms because you're extending your wrists.
Yes.
So it's just a great counter pose to our everyday hunched over posture.
So somebody working at the office or working a job like that can set a reminder every 15 minutes or every 30 minutes or whatever to get up. Boxers, we can do this between rounds. This is another preventative measure along the lines of injury prevention, making sure that you don't get it and making sure you don't have to deal with it once it's injured, being sure that we're working on the preventative side.
Just to add to that, I get a lot of people where they'll think, well, I don't have time for that. It's going to cut into my productivity. I can't take a break. And it's like, you literally can do it for 5 seconds. It doesn't have to be a long time. You
So
just stand up, counter pose, sit back down, type away.
It's the regularity.
It's the regularity. You just have to break that static posture of always being
The thing is that if somebody gets injured, they're already going to have to face something, spend a lot of time facing it. So this preventative measure is going to save them a lot of time. Because with boxing, shoulder injuries they're just everywhere. So with these exercises in this stretch, saving you a lot of time and pain in advance. So, okay, let's go on to the next section. Let's say somebody is injured. They've been boxing, at it for a few months, and maybe one day they're just feeling extra good and they go at it too hard, and all of a sudden you feel that, or the next day you wake up and you feel that the inflammation or the pain in the shoulder. What are the next steps that somebody should follow? What would you recommend immediately?
So you just made me think of a good example of how a boxer is going to get injured. I think we talked very briefly about it at the start.
Yeah.
Boxer, you're sparring with your buddy. You go to throw a nice punch. You miss with the punch. So your arm comes forward.
Yes.
You have to slow it down so it doesn't fly off. We talked about that, right? With the pitcher.
Deceleration.
The deceleration is where you can tear your muscle, get an injury to the tendon. So now what do? Let's say later that night you start to notice, oh, I got a little bit of pain going on right here.
Sometimes you feel it right away, or sometimes
it's not always right away.
That's right.
It could be the next day even. Sometimes it takes a while. So the first line of defense that I truly believe in, there is controversy over ice versus heat and when should you use them and all of that. I'm a huge proponent of cold therapy, cryotherapy.
Yes.
The first thing I do with all my patients when they injure the rotator cuff is I say, you got to go pick up one of these.
Now, just to stop, we're not sponsored by this brand.
Sorry.
But they want to know, what is the brand?
Yeah, this one's called Cryo Blaze.
Cryo Blaze.
I don't actually have any affiliation.
Yeah, there's no relationship to this.
It doesn't matter to me as long as it's flexible and it's a reusable gel pack that you can put in the freezer.
Or the microwave.
This one you can put in the microwave too. So you can have heat pack or cold pack. I recommend the cold pack right away. Get it on there.
So let's say somebody's feeling it. You want to reduce the inflammation, and you were explaining why that area is already so tight.
So what you have to, the way you need to look at it is that a little bit of inflammation is good for you. It helps to heal torn,
bring nutrients.
Bring nutrients in there. It's going to repair.
Yeah.
So some inflammation is needed. The body tends to overdo it. Think about if you ever sprain your ankle and you get that giant, just blows up.
Swollen up.
That's a little too much. You don't need that much inflammation, right? So that's why we work to eliminate the inflammation, then you're going to heal up faster.
Yeah.
That's kind of the same thing with the shoulder. Now, you're not going to notice that it's all swollen.
Yeah, it doesn't.
It's more of a micro edema situation where there's just a little bit of swelling deep in there.
Yeah.
And that's where the ice comes in. So I like to think of it as it's kind of like you got a bit of a fire going on in there, and you need to put that fire out. So how do you put the fire out? Just get that cryo cuff on there, or your ice pack
to get some cold.
That's going to get deep in there. It's going to decrease the inflammation.
And how long would you recommend to put the cold on for?
There's controversy over what is best. I believe that doing 10 minutes on, 10 minutes off, 10 minutes back on again, and then repeat in an hour.
I see. So 10, then 10 minutes off, 10 again, repeat in an hour.
In an hour.
And then how does the heat go in? So it would be 10 cold, off
with nothing,
off with
then 10 cold.
10 cold again.
Nothing for an hour.
Nothing for an hour.
Some people, though, may want to try heat as well.
Okay, so you're a proponent of the cold, but let's say if
cold is more important to me with a fresh injury.
Oh, I see. So
heat is better with the more chronic type injury where you have muscle tightness and you want to loosen yourself up.
Right. So if you've had something for a while, let's say a month or two, and now you decide you want to start treating it, heat is very important to loosen that area up.
Yeah, I think
if you just got it yesterday,
a combination of heat and cold is good in that situation. But you're right. If you just had it yesterday, ice is your go-to for the first, let's call it the first week. Right. Ice is going to be your best friend for that.
Right. Okay. And then if you had something for a while, then you'd be looking at heat.
Heat is always going to, heat obviously warms up tissue. It increases flexibility and pliability of the tissues.
Yes.
So heat is a good thing to use before you train.
Yes.
Get you all warmed up.
Yes.
Yeah.
Oh, I see. Yeah. So heat even before I train. That's why the warm up is.
That's why the warm up is key. Exactly.
Yeah, the warm up is very important.
That's why you want to always do a warm up in any kind of athletic
Make sure that the
activities.
muscles are pliable.
Yeah, you don't want to go out there with cold muscles.
So let's say we got somebody who is injured. They're applying the heat and the cold. Now, I had a shoulder injury that I worked through it, but it was always annoying me for 6 months. So 6 months, this is happening to somebody. What should they do? Should they be giving up boxing altogether? Just maybe shadow boxing with that side? Like, how do you balance that being a professional versus the person who just wants to go out there?
So my plan usually with this type of thing is it obviously depends on the severity. There are different degrees of injuring your rotator cuff.
Right.
You could say it's a first degree, it's second degree, it's third degree of severity.
So you need to get a professional to assess.
You want to get assessed, find a really good sports therapist, physiotherapist, chiropractor who deals with athletes.
Right.
Get a good diagnosis first.
Because you really need to know what is going on in there for you. You might have pulled a certain rotator.
That's right.
You need to target
Everyone is different after all. There's very common injuries that happen, but there could be something else at play there. You want to get a proper diagnosis first.
Okay, so that's
and then get you on the right track. So what I was going to say is usually what I'll do is for the first week or so, I'll say no boxing for the first week.
Cut it.
And we're going to be aggressive with our treatments and try and get this fixed as soon as possible.
So they can get back out there.
Yeah, so they can get back out there. And I always play it by ear, see how they're feeling. Maybe after 2 treatments, they're feeling great again, we can start to resume.
Yes.
But you want to put the fire out first.
Right.
You don't want it to blaze out of control.
Yes,
right?
I see. Then after a while, your shoulder's going to be like this.
What's better? Take a week off boxing or fight through it, and then 6 months later, you still have it, and now you've got to take a month off.
Yeah, that's
so it's better to just get it taken care of quick.
The other thing too is that you just the punch doesn't have the same juice. With that injury, you're still throwing punches, but they're not really your best, and so you're not.
It's also in the back of your mind too,
it's in the back of your mind. You always remember that.
That's right.
As you're going through. Okay, so another area that we're talking about with injury, once somebody's injured and they're going to rest it, they're not going to go back to boxing because boxing is full-on whipping explosive movements. But is there something in between that somebody can do to strengthen their shoulder so when they go back to boxing, they're better prepared? In that interim stage, if you can give me some exercises for that.
Yeah, so now everyone's probably seen this one. If you can just get a band, or you can go to your gym and use the pulleys.
Yeah.
So you just set that one up. This is just a common rehab exercise. You could also call it prehab. Prehab or rehab. And what you do is you just have this attached to something. I'll get you to hold it maybe.
Yep.
And I'm just starting here, and now I'm going to pull it out this way. Same rules apply as that scaption exercise. Keep the shoulders down and back. So it's important to
keep the shoulder down into the socket.
Yeah. Now, people tend to do this.
Yeah, because they want to power it through.
Yeah, because now you're recruiting more muscles, and it's like, oh, look how strong I am.
Yeah, but you just want to hit that.
Yeah, you want to keep it really specific to the rotator cuff.
And you were saying that this external rotation is important for the deceleration. If I miss...
That's it.
That external rotator has to keep my arm from falling off.
Exactly.
So this is important for sparring or even explosive shadow boxing. That miss can cause you an injury. So it's important to strengthen these external rotators in that case.
That's right. Jason made a good point in your previous video about the shoulder strengthening. Yeah. That when you do this in boxing,
right? Never.
That's not a move, right?
Right? No, never do that.
But why should you do it now? Because it's going to strengthen your stabilization muscles of your shoulder.
Yep.
And just like you nailed it there, that's going to help you with the deceleration of the arm. So it's not popping out and it's not driving in here.
And you can feel that looseness.
That's right.
Sometimes in the socket. So just with that exercise, sets and reps, and how important is this thumb external rotation? Like if you're working, do I really want to turn the palm or no? Like
you can keep it more in a neutral. So this is sort of a neutral place for your hand and wrist to be in. So it's more just right there.
I see. Okay,
so I'm not really twisting it out.
It doesn't have to be.
I'm just keeping it in line there.
The muscle's still going to get hit from that motion.
And if you have one of these bands, I'll just take it for a sec. You can also do You can kind of do that scaption thing with a band too. So you can just bring it up like this.
Instead of the dumbbells.
Yeah.
And that keeps constant tension.
Yeah, and you can always tighten up the tension by grabbing.
As you get stronger.
Yeah. And
So
there's different colored bands too. You can go with the blue is stronger, black is even stronger.
Right. Now for sets and reps, would you just say like, 3 sets of 15, that kind of range?
Exactly. There's no real set, but usually you're going to do higher rep for stabilization.
Yeah, because you're not going to go.
You're not going to power through and do a 1 rep max.
Yeah. Imagine external rotation.
That's right. So you want 3 sets, 10, 15, 20. Doesn't really matter as long as you're getting those sets and reps in.
Getting the sets and reps in, and the muscle is injured, so you don't want to try to overwork it.
That's right.
To stimulate.
That's right. Yeah, and use pain as your guide. If you're getting pain with any of these movements, your body's telling you something.
Yeah.
Don't do it. Don't.
That's right.
There's very few things where it's good to fight through the pain.
Yeah.
There's very few.
Especially with shoulder injuries. No need to fight through that pain.
That's right.
Okay, so just to summarize some of the things that we went over. Injury prevention, strengthening the muscles of the shoulder, going out on that 30-degree plane.
Mm-hmm.
That's one exercise you recommend. So you can get started on that right away, whether you're in boxing already or you're about to get involved in boxing. That's a good one to start.
It's good for everyone.
Good for everyone, especially for the shoulders. Again, also we were talking about prehab in advance. This stretch, getting a sort of a routine or a habit of making sure that you're opened up, whether you're a boxer or whether you're working at the office, doing whatever, right? If somebody is injured, we're looking at ice primarily. And then if somebody has had an
Get a diagnosis too.
Get a diagnosis, okay. So that's right, you heard it from the doctor. So diagnosis and taking care of it yourself, looking at a cold pack.
Oh, something I just remembered. Don't sleep on that shoulder if you can. If you're a side sleeper, because think about it, when you sleep on that side, it's pushing it forward again.
That's another thing.
I forgot to mention that one.
Yeah, and some people do, so that might be like 25% of the population.
Right.
So, and then going on after a diagnosis, cold pack, 10 minutes on with a rest of 10 minutes on again, hour break and repeat. If somebody's already injured, they'd be looking at a blend of cold and hot. Okay. And another thing for strengthening the shoulder in terms of if you are injured and not ready to go back fully to boxing, working some of the common internal, external rotation is probably the best exercise to get you back up to full strength while you're in between being injured and back at it fully.
Yeah, you want to look at it as a lifelong process. You don't just do these exercises to,
When
rehab or when you're injured.
Right.
You just do it all the time.
Right, okay.
So you just want to always have stability in your shoulders.
So these would be, with the other shoulder video, these would be a great addition
Exactly.
to those 4 exercises and the habit of doing this.
Of counter posing instead of being hunched over all the time, which is
I got to do that.
Which is really the cause of so many injuries nowadays.
Chronic positions.
Neck injuries, back injuries. It's that we call it repeated micro trauma. So you're just in this shitty position for 8 hours a day, and it just builds up over time. And then, they say the proverbial straw that broke the camel's back.
Right, and it's not even really, we always talk about the office worker, and there's a lot of people who don't work in the office, but you're saying on your phone, on your laptop for personal use, you're still working those sort of postures. You're still in those postures.
That's right.
And that's building up as
It's
it goes.
all builds up over time. Yeah.
All right, Dr. Jory, thank you for your time. I appreciate all the knowledge and information. And so for you guys out there, you who've seen my last video on shoulder strength and stabilization, this is going to help you also as well with the injury prevention, or if you're injured, give you some steps on how to fix that, because I know personally, we all know shoulder injuries are everywhere, especially with boxers, and so you want to make sure that you prevent that as much as possible. I'm also going to leave a link to Dr. Jory's YouTube channel in the video description below, and thanks for watching, guys. Peace. All right, that's good.
Nice.
That
That was good, buddy.
That
Nailed
is
it.
good. Yeah, we did. You know what the thing is that once you got so much knowledge, see this.